successfully your research programs at SDM University. We have been undertaking several efforts towards this, and this is one such event which we are hosting today from IKP Hyderabad, who are going to talk about the programs which have been recently announced by Government of India through the BIG and BIRAC program, and which primarily provides funding for the research programs, which leads to primarily processes or products which could be commercialized in future. To tell us something more about it and various intricacies which are associated with the program, we have Dr. Vishwanathan Dupatla, who is joining us through online from IKP Hyderabad. And we also have Mr. Sushil Ujni, who is with us and who is also going to tell you something more about this program. After the presentation, this will be followed by a question and answer session where you'll be able to clarify any issues or questions which you may have in relation to this funding call by Big BIRAC. So without much ado, let me hand over the mic to Mr. Ujjain, please.
Thank you, Dr. Satyamurthy. We're very glad to be here at SDM University. We visited last year and we began the initiations, and Dr. Satyamurthy has really been keen on taking this step forward. And he said, hey, look, the BIG grant is something that we would like to get it kickstarted with. So with that, now I have my presentation also on. So let's formally start it. So Yellarigu Namaskara. I represent the Government of Karnataka's K-Tech Innovation Hub, which is a joint initiative by IKP Knowledge Park and the Government of Karnataka's ITVT department. This is an initiative which was started about 5 years ago, where in the state of Karnataka, we've been enabling grassroots level innovations. So there's a lot happening in the cities. Bangalore, we're overcrowded with startups. There are too many startups that we have in Bangalore. It's a good number to have. And taking it further in 2017, we said, hey, look, this is something that we want to do it in other parts of the state as well. So with this initiative, IKP joined hands with the Government of Karnataka, and they said, let's set up centers in such a way that you have the state-of-art facilities available anywhere in Karnataka within a range of 150 kilometers. So that's what happened, and I'm going to take you through the same, and also a little bit about what we are as IKP Knowledge Park. And then I also have my colleagues that you previously saw, Dr. Visu and Apurva from the BIG program as well, who will be discussing the details of the BIG grant today. So moving on to the next slide. Slideshow. Just move to the next slide. So IKP Knowledge Park, so we're about 25-year-old organization now. So we have our startups in almost every state of the country. So when I say we have our startups, these might be startups which are early stage startups or expansion stage startups or growth stage startups, as we classify them into different segments. As you can see, we have supported more than 12,000 entrepreneurs, and a lot of jobs, both direct and indirect, have been created. And one thing we are very proud as IKP Knowledge Park, because we work with both the central government and the state governments at different locations, is our investor multiplier. So we have our investor multiplier about 31.5x. So that means when IKP leads the investment, so there are 31 others who would like to invest as well. So that is something that we are proud of. And of course, as you can see, we are majorly concentrated in Telangana because we have a 200-acre campus over there. It's called the IKP Research Park. That's where we have our anchor companies, as we call them, where the major research happens for IKP Knowledge Park through our anchor companies. And along with that, we also have various incubators, which we'll talk about in some time. Telangana, and then you can also see the Karnataka region, where we have about 411 startups already, majorly concentrated in the Bangalore region and the 5 CAFs that we were running. Moving on to my next slide. So these are the incubators. So all in all, IKP Knowledge Park runs about 9 different incubators of its own, with some of the government agencies like the Karnataka government as well. So these incubators that you see, the LSI, that is the Life Science Incubator, Catalyst, the One Health Incubator, the Analytical Labs, that is the A Lab, and the Sustainability Innovation Center. So these are centers that are there inside the research park. So all of these incubation centers are inside the IKP research park there in Hyderabad. We also have a city office, so that IKP research park is about 60 kilometers from the city of Hyderabad. So to ensure that people are able to reach us inside the city, we have a city office as well, and operations happen throughout in both the locations. Moving on, some of our other incubators. So in Karnataka, what we did is in 2016, we set up what is called as IKP Eden, Engineering, Design and Entrepreneurial Network. So that here in the state of Karnataka, we wanted to build a lot of medical devices as well. So it started from there. You might have heard the story of Dozy, one of the leading startups, I would say top 10 startups of today's world. And we were one of the early investors there. They built their products in IKP Eden, and we are very proud of that as well. You might have heard about Niramai. So they are one of the incubated startups of IKP Knowledge Park as well. There are a lot of stories which my BIG team will also give in the next slides as we move on as well. And we also have a BioNest incubator at IKP Eden itself, where currently about 20 startups in the medtech zone are working on. And then, as I said earlier, so we have 5 Eden satellite centers. So whatever we have, Eden, it's a 25,000 square feet space. The same thing we recreated for the government of Karnataka in Tier 2 cities. Given that it was Tier 2 cities and smaller spaces, we just required about 5,000 to 10,000 square feet of space. And this space, we have been able to create smaller hubs known as the common instrumentation facilities. The nearest one here was in Belgavi. Now we're in the mode of transit for it. So these are the 5 locations which were there for the people here in Karnataka to access as well. Moving on. The innovation ecosystem of IKP Knowledge Park. So what we do is, from the idea stage to ensuring that your idea actually commercializes. So we handhold you throughout the process. And how do we do this? There are a lot of people involved in this. Majorly, we also have the IKP Prime team, which is a team of 5 advocates and who can help you out with all the IP requirements. So you want to file your patents, you want to file for trademarks, you want to have a research done, market research. So all of it happens through our dedicated team, which is called the IKP Prime team. Once you have an idea, you want to just talk to any of us, we'd be happy to help you out with these things. Of course, technology transfer and commercialization is also a part of it as well. Moving on, next slide. Recently, we also discovered that building medical devices is one thing, but then getting the permissions from the required regulatory authorities was a whole different ball game. So we have been discussing with many people about this, and then we said, hey, look, let's start something of our own, because nothing of this existed anywhere. So we said we created the IKP Global Regulatory Forum with JSS Academy of Higher Education and Research. Dr. Surendra Singh was available, so he's the chairperson of this. And with him, what we've done is, anybody who's building a medical device, if you're stuck at any point of your stage through the regulatory forum, like the government departments are not able to understand what you're saying, which happens most of the times, unfortunately, or maybe you have applied in the wrong category, or it's just been too long since you submitted to the government. We'd like to step in and check what has happened and help you ease the process of getting the required regulatory norms from the governments as well. So we've set up a body, and most of the regulatory agencies across India, this is not just in Karnataka, but across India, are working with us to ensure that medical devices are built from India for the world at a faster pace. And moving forward, the collaborative ecosystem. So we've just started building the ecosystem across here in Karnataka as well. You can see some of our partners. Very soon, we would like to see SDM also here. We've already started initiatives here. So a lot of our other incubation partners, other institute partners, we work with St. John's, we work with the Derby Foundation, the Dayanand Sagar, and a few more that we work with in the biotech segment. Moving on. These are some of the startups. I'll skip this from my presentation because we'll talk more about the BIG program and their startups. You can just run through the next slide. These are more startups of ours. We have a lot of startups, of course. Yeah. This again, so these are some of the Karnataka oriented startups. There's something called as Elevate, which is a government of Karnataka grant, again of 50 lakh rupees. So some of those recent winners. Move on, please. This is something as a center, we were able to help people during the COVID as well. So from early stage incubator, when there is resource available, what can happen? So this was the proof. This was in Mangalore, not even in Bangalore. So our Mangalore center, our Belgavi centers were actually very good in product development during COVID. So that is what we wanted to showcase. Hey, look, in a tier 2 city, if you provide the right resources, then a lot of things can be done when the entire world was on shutdown as well. So with that, next slide. More stories of our startups. We are on ground. We have our startups working in fields where they're doing much research with the farmers. They're coming up with new vehicles as well, unmanned vehicles and more like that. We have a lot of success stories to talk about. We can individually discuss. Next. So the grants that we maintain, so IKP has been in very good relations with various organizations throughout the world. We've worked with Bill and Melinda Gates Foundation. We have worked with the USAID, the UK aid on different things. So the key factor is we take up some very, what do you say, top-notch segment problems to solve here in India. And then we work with the agencies that like to solve them for India. These are some of the previous programs that we have run, and some of them are continuing even today. Moving on. This is the Government of Karnataka Elevate program I told you about. All these grants we can discuss offline. Next one. So this is again something that we happen. So initially, if you're just starting out, maybe you can get started with Nidhi Prayas, a grant which is a 10 lakh rupee grant to begin your product journey with as a startup. And then, of course, in today's discussion, we'll dwell more on the Biotechnology Ignition Grant, which is from the Department of Biotechnology, Government of India. Where it is a 50 lakh rupee grant. It's a great opportunity for all researchers like yourselves and your colleagues who can actually make use of this money to actually see the product in the market. It's not only for research. We're going one step ahead and say, hey, look, if you were given this grant, it is mandatory to form a company and take the product into the market, right? So to dwell more on this, I'll request my colleague Apurva to come on and take the next session. We'll take the question answers at the later stage, please. Thank you. We'll move on to Apurva's presentation. Apurva, over to you.
Thank you, Surat, and very good afternoon to everyone. Just let me know if I'm audible enough and my presentation is visible. So I am going to take you briefly through BIG and its component. Later on, we have Dr. Vishu to highlight some of the case stories from BIG and their journeys. Is it full screen?
Yeah, Apurva, yeah, it's open now. It's full screen. You can go ahead, please.
Okay. So, hi everyone. This is Apurva. I handle BIG at IKP Knowledge Park, and I have 8-year experience in startup innovation ecosystem, facilitating some of the grant program accelerators. And currently, through IKP, we handle startups through various schemes, which Suhrut had mentioned briefly in his previous presentation. BIG is one of the early stage grants which have been very impactful in Indian ecosystem, starting this especially in the biotechnology sector. So IKP has already taken care of. I'll start with BIG. So IKP, being one of the BIG partners since its inception, have supported 192 startups and individuals so far across 90 cities in India. This is the whole ecosystem which BIRAC, which you must aware, is an interface agency between industry and academia, support startups and entrepreneurs from their idea to POC to scale up and manufacturing stage through various schemes, be it grants, fellowship, or equity-based funding. BIG is specifically for startups or entrepreneurs or faculty students who have some idea in their mind and want to establish their POC, or even if they have prototype or technology and establish its validation, that is also supported under BIG. It's a 50 lakh rupees grant given for 18 months to the startups and individual. Any person who's a graduate in any discipline can apply, or any startup who is less than 5 years old and from its incorporation can also apply for this. The area supported under BIG is agriculture, food and nutrition, drug and drug delivery, biosimilars, diagnostics, medical device, secondary agriculture, waste management, industrial biotechnology, and any allied sector, especially for the life sciences, and any digital MIM, AIML based solution overlapping all this area will also be supported under BIG. Recently, BIRAC has also announced with IHF, along with IHF, a co-funding opportunity in these sectors, which are innovations pertaining to AMR, tuberculosis, vector-borne diseases, disease surveillance, and climate and health challenges. The selection process includes 4 to 6 months process, starting from opening call for application, the deadline for which now is 31st May 2024, after which it goes for online selection, where the application goes to 5 subject matter experts, they score it, and then the selected people go to face-to-face presentation, which usually happens in Delhi. And then again, the scoring happens and BIRAC announced the final selected applicants. This is the same process. I can share my presentation with you all to go in detail. It just implies on the same that startup who's applying should have 51% shareholding by Indian citizens, and the PI who's a project leader has to be the shareholder in the startup. If you're a faculty or a student, if you're faculty, you should have an NOC from the institute, and student can apply as is, providing they have a team who can pursue the project for 18 months and more. So BIG, it's a simple process. You have to apply on the BIRAC portal. You have to create a login. And if you have already applied for some of the other scheme from BIRAC, you can use the same login. And then you have to log in, go for the 4th number, which is BIG, if you're applying for BIG. If you're an individual, they will ask for the incubation detail, which you can take from your own incubators. The LOI is required when you apply for it. If you are a company, you would have to enroll your company or register your company on the BIRAC portal itself. Generally, it's there, but if not in the scrolling of the company name, you would have to register and it will show up after 24 hours on the portal. This is a form of new company registration on the portal. So that when we talk about the grant, how we write the proposal, how is the presentation made, and what are the things then you need to take care while you are writing the proposal is the scoring criteria, which the reviewer will take and judge your proposal on. So it is unmet need, the problem you're solving and how it is addressing the problem, value proposition, what are the benefits you're providing with respect to conventional solutions, technical viability, that do you have any credible publication, a background IP or any of your own data which establish the technical feasibility aspect of the same. The team, like I mentioned before, if one person cannot do everything in the startup or say to take forward the innovation. So if you have a team of a mix of marketing, business advisor, scientific advisor, it is not mandatory, but it adds value. Business perspective, BIG being an innovation grant, it always encourage the faculty members to even form a startup and have a commercialization product or technology going forward. Apart from this, IP and regulatory strategy, clarity in the proposal need to be provided. You may not have IP at that time or regulatory, but at least what class your device if you're working on and what regulatory criteria it will follow. If you have idea, it's better. The components include these components. I'll take one by one in my next slide. So title, please keep it very crisp and unambiguous. It shouldn't have all the details in one title to give a reviewer a fair, quick glance what you are trying to achieve. They may have thousands of proposals, and by seeing your title, it's essential that they should get a grasp of the same. Introduction, you can briefly in paragraph define your problem, the market for it, who's going to buy the solution if you create a solution from that problem. Are there any customers available, or if it is better than the previous available conventional solution, who are the buyer and what they can buy it for, what is the price. The solution, you can briefly describe how your solution is addressing that problem and how it is better than the other ones. Tech details, here you can always mention how you propose to solve and what is the functionality of your solution, and if there is any publication or IP available and you're going to use it, you can mention it in the tech details. Current status, what you have done so far and what you're trying to achieve in 18 months with 50 lakhs should be clearly stated in that. Value proposition and differentiation is simply your USP or a combination of benefit you're providing to the customer. So your solution can be cost effective or with a higher turnaround, faster turnaround, with higher sensitivity, efficiency, or even bioavailability in case you're working in drugs. Novelty, as I mentioned, if you have your IP or you have already filed the provisional IP that you can mention here, or BIG being an innovation grant, novelty aspects is very important. Even if it's an incremental solution, how it's going to add value to the existing ones would also be highlighted here. Competitive landscape, it's very important. We always can say our solution is better, but then how we are making the reviewer understand all of this. So we have to have a comparative landscape given to the reviewer with respect to other conventional available solution, and featuring your product feature, cost, what are the attributes it has. If it's adding to import substitution, please add it. The team, as I mentioned before, apart from the PI project leader who's leading the project, if you have any business expert who can advise on the go-to-market strategy, or any scientific advisor who you can take consent beforehand, can validate your technology, can also be added in the team for BIG. And not only for BIG, it will also going to help if you're thinking of making a startup to run, and in a long run, it's going to help to have a team in place. Objective and milestone, it's pretty much same as your research proposal, how we write. Objectives can be broad in terms of 3 or 6 months, or say 12 months goal. Milestone has to be very quantitative. So if some reviewers is reviewing your proposal, if they should know that in 1 month's time, what is your goal and what is your timeline. So if we're talking about sensitivity, we should have a current value of achieving that much sensitivity in 2 months' time or 3 months' time. If not, what is your plan? And if yes, then what is the next plan? So that is how you can design your objectives and milestones. Budget allocation, you have to see what the grant agency asks for. Here, BIG asks for recurring and non-recurring budget, which includes CapEx and OpEx in terms of equipment, consumable, HR, IP, and travel, and contingency. It's better to mention the equipments and consumable requirement with details of how they perform, how they can be used in the project execution in the 18 months. What is the quantity that you need, and what is the estimated price of that equipment or consumables. So justification is very important here. IP strategy, I would request Dr. Vishu to please take over from here. So as Surut mentioned, we have our IKP Prime office who deals with IP, tech transfer, legal, and other services, who helps entrepreneur startups who come and who wants to do prior art research or even filing for IP. We work with them beforehand. Dr. Vishu?
Thank you, Apurva. So let me share my screen.
Sure.
First of all, congratulations to SDM management and the faculty members. The reason for it is the first time actually one of the innovators from Bangalore has moved to a place like Dharwad. This is a cell agility team. It's a company established in Bangalore with multiple partners, and Dr. Vishwas from SDM is an active participant in this. While I'm just trying to figure out to share the screen, I will just mention, we have our 25 doctors. I understand, today mostly the medical college related faculty will be there. So I will just try to focus more about the case studies of, some of the doctors and, other medical researchers who came on board with some of these programs. How many of you are aware of Dr. Vishal Rao from HEG Hospitals? Or it's not possible to unmute and answer? It's a very convenient actually for. Surut, is it possible to unmute and answer from there, or it's not possible?
Yeah, it is. They can speak.
Any of you are aware of Dr. Vishal Rao from HGC Hospitals?
Not at the moment.
Okay, so he's a doctor who actually seen a problem mainly with reference to a particular device called the voice box. In particular forms of cancer, throat cancer, they have to remove it and it should be replaced. So until recently, it's only coming from Europe and Western countries. It will cost anywhere, the surgery will cost anywhere from 30,000 to 1 lakh rupees. So when he had seen that it's quite expensive and it's more like, very simple engineering wise, it's a very simple solution. So he came with this proposal in the Biotechnology Ignition Grant, where he suggested that it can be made for 100 rupees. Actually, there is a story in BBC. This came like, voice box for $1 or £1. So now there is a facility supported by the government in Karnataka for preparing these voice boxes. It's a very simple, biocompatible resonating material. Now the surgery is a OPD procedure of 30 minutes and costs 5,000 rupees, including everything. So when a clinician looks at these things and goes to relevant partners, and of course there are various funding opportunities. That is the main idea of putting this session together today. So it won't be like a presentation mine. I will be looking forward to questions from you people. And I thought I will speak about few of the solutions from Karnataka. So mainly these are the people, students, engineers, doctors from various places. We have, I think, over 25 doctors who came, in partnership with various engineers and applied for these programs and successful. Much more people have applied, but these 25 are successful. I just picked few very simple ones, which I felt that we all should know about these things. So in 2015, this company was started, and that is just when I joined this organization, IKP Knowledge Park, for last 6 years. I take care of the grant management and the incubation. So that time they wanted to have a contactless vital monitoring solution, mainly to measure without disturbing anybody. So we know that everybody needs to be monitored, but nobody likes to be called as a patient. That's how this came. And during COVID time, they were able to convert most of the ICU beds into a step down ICU with 10,000 rupees. So, during 2020, May, June, the cost for, getting an ICU bed is around 15 to 20 lakhs with a 30 days lead time after the payment in euros or dollars. So one particular hospital in Hyderabad, they were able to demo in the evening, and next day morning, the minister opened the COVID ward. So basically 100 beds with this monitoring solution with a dashboard that will tell the doctor who are those 3 or 4 patients that need the help. Of course, they have excellent algorithm that predicts possible, heart-related incidents, and NIMHANS and other researchers together, they have actually validated in few of the cases when there is alarm given that there may be a possibility that in next 24 hours there is a heart-related incident. It did happen. So they have published this data, and you can just go to the DOZE. If you are looking into your phones now, you can just type DOZE, DOZE. You will look at the present impact what there. I will not get into these details, but in 7 year time, these engineers with the support of doctors were able to generate an idea into establish the POC, and they raise over 200 crores. And most important things in this particular thing is they were able to take the solution to a government hospital. Like you might be knowing how cost conscious the government hospitals will be, but this solution was able to provide assistance to the places where the number of doctors and nurses are less, because it is telling that out of these 20 or 30 patients, who are those 3-4 needs help. So another again based on the need, very simple solution, an elegant solution by set of engineers who are working with physiotherapists. I presume SDM group of institutions also have a physiotherapy college, and some of the physiotherapy college actually evaluate the trainers efficacy, how effectively they are training using this device. So we'll be happy to introduce. So please let us know if you think that this will be useful. Maitreyi and Suresh, they came up with an idea. So after a physiotherapy session or during rehabilitation, how do you know what is the extent of improvement. When we go to a physiotherapy session, we say that, yeah, I'm feeling slightly better. When you are going for, most of these things, it's very subjective. But these people were able to bring in quantitative measurement, and how much is the pain, how much is the range of motion, how is the improvement. I myself have been a user, like I had ACL ligament surgery, pre-operation, operation, post-operation, over 9 months. They are actually writing a case study, and now I regained 86% of my normal leg efficiency in terms of walking, movement, and muscle strength. So this actually helped various established physiotherapists to tell the patients the need. The patient sees that there is a 6% improvement with a particular kind of session. The patient is actually motivated. Unfortunately, compliance is very important in most kind of medical treatments. In physiotherapy, it is even more. It's very boring to do some of these exercises, but when they went to the doctors, they were very happy to see that they were able to do. And most important thing in terms of physio is, now the entire process of physiotherapy, rehabilitation, treatment, evaluation, everything is a part of the insurance program. The standard insurance actually covers this one. This is the first startup solution to be covered by these things. And the physiotherapists are very happy, because for a critical patients and a stroke patient rehabilitation, it's very important to know, even there is a 2%, 3% improvement, it is good to know which kind of exercises to continue. I will not get into very specifics. We'll be happy to request the team and maybe some hospital whom you may be knowing will be using these things. But the value proposition they bring is, compared with an MRI gives a frozen shot of particular ailment. In this particular case, they were able to pin down what are those 1 or 2 muscles that are defective. And it's very nice to hear from established hospitals that in particular rehabilitations, the physio, which costs 200 rupees, the solution is much more detailed than the static MRI images. So it's more like functional analysis of particular region that is affected. So as I mentioned that some of you will be much more knowledgeable than me, so I will not get into these details. But if anybody is interested, we will actually invite the team, or have a separate call on this. Again, I am sure there will be some pharmacy students and researchers across most of the medical institutes, and they are very good with the formulations. So a set of formulation experts came with BTech and BSc students and MSc students. This is from Dodbalapur area. So when they found that during their MSc projects, they have one fraction that is attracting the insects very nicely, that particular fraction 3, let's say. So they came to IKP asking how they can apply for any of the innovation grants, or any they want to make a product out of that. So this is what actually we have asked in the step 1. Can you show that this is very specific and it attracts the insects that are targeted to particular one and not the good ones like honeybees and all. So they have done those control studies, positive controls, negative controls, specific, non-specific, and they have established all these things. And thanks to all the network of all the regional institutes, IITs, IIScs, and other faculty members who are interested in supporting these students, they actually found out that chemical that is responsible, and also IKP Prime team sat with them and what are all the value propositions they can build in terms of intellectual property. So IKP Prime is the IKP's technology transfer that helps the faculty members and students, anybody actually looking forward to develop a product or a technology. It's important to know who is the competition, what is there in the market. And I said Tirupati students actually received, there is a competition called IGEM, International Genetically Engineered Microbes. This happens in MIT for all the undergrad and grad students across the world. So both the times they won the gold category, and very proud to say that we worked with the students and helped them with various IP related things. Yeah, I think I will take a pause here, and we'll be happy to have the Q&A session rather than me going, because the third case study was more about an engineering and a solar case study. If you want, I can continue. I will take a cue from your responses. Should I talk about a a solution to the farmers from the solar, or you would like to have a Q&A?
Dr. Vasu, they'd like to finish, continue with this, and at the end we can do the Q&A.
Great. So as you know, in most places, across world, they are developing the solar panel, farms. But when they are developing, there are various problems in managing these and maintaining these things. So there is a company again. This is again from Bangalore. They came up with a very. These are two engineers who are working with Cisco. Came up with a very simple solution. By can we increase the height of this one and make the panels translucent so that light passes through. I don't know if you can notice in the right side image, the first panel is the traditional solar panel, and the remaining ones are the Renku based translucent solar panels. So basically, what this does is it allows the light to pass through but reduces the intensity of the light. So actually, in summer like Hyderabad, I don't know about Dharwad, but in Hyderabad in summer it's very difficult to grow most of these kind of crops. But using these kind of things, actually it helps by bringing the temperature slightly down, and by growing the crops below the panels, these crops release the water. So this water release reduces the temperature, and a low temperature actually helps reducing the resistance and increasing the production of the solar light by almost solar energy into electricity. So almost 23% increase in the efficiency was observed. And this is a test farm after receiving the Biotechnology Ignition Grant. A university from Australia and a large investor wanted to see how it works actually. On the paper it is looking good, on the prototype it is looking good. Can they have a look at a small field study? So Agriculture University came forward and tested this thing, and it's very interesting to note that most of these crops are actually growing better with less water requirement, because though it is at a more than 3-meter height, it actually reduces the water requirement by certain percentage. So these are various measurements, how the electricity is produced, how the water is consumed, how the crop is growing in a controlled climate versus under the translucent the specific panels versus the traditional ones. In all the cases, it was established that if any engineering students are people with such interest is there, I just want you to see how they developed this very simple prism. So basically what this prism does is it increases the light capture. So there will be additional 30% light coming onto the panels without any movement. So there have been several trials and attempts to increase the light. The sunflower type of model, the panels will move, but they all need multiple things. But what these researchers have done is to have a simple prism. Throughout the day, these panels will receive more light. So this is what actually they are demonstrating. And as a last, it's not like a case study, but I just wanted to mention this one since we will be talking with various science students. Lamarck Biotech is a company, postdoc basically. When he was working in Spain and Paris, he wanted to develop formulations that are thermostable. Basically, he started with insulin, but any drug, be it an enzyme, hormone, that needs 4 degrees or -20 or -80, be the case of mRNA vaccines, can we have them at room temperature and more stable? So he was able to demonstrate until the animal studies for the insulin, and he is working with various molecules. The formulation helps to stabilize these biomolecules at room temperature. Of course, they have done the studies at 50 degrees, but for most practical reasons, if some these are stable at 30 degrees, they are sufficient. So this company makes such formulations and working with various industries. Thank you. And if you have any questions, we'll be happy to answer. But please note that is the email ID, and Apurva will share the presentation, and looking forward to questions from you. Thank you.
Thanks a lot for the examples and sharing your experience, Dr. Vasu. I'm just opening it up for the people for questions. Yeah. So if any of you have any questions that you'd like to ask.
Just to save time, I just want to mention few examples how the researchers, when they are thinking about developing these things, they can look for the assistance. So HOD from AIMS Jodhpur, he developed a very simple solution to address certain patient needs, and he was looking for help who can develop the engineering part. Of course, he came to IKP. I will be telling all the IKP examples, but there will be several institutes where you can go, and many a times doctors by themselves will not be having time and resources to do these kind of things. I would suggest you don't have to do these things. You should look for partners who will be doing those things. Thank you.
Thank you, Dr. Vishwanathan, for this enlightening session. We have a large number of student contingent also in this audience. You had indicated that there are opportunities for students to be able to become entrepreneurs in the beginning, or maybe it was Dr. Apurva. So can you please elaborate on that?
So in the BIG program, there should be, when they are applying, either faculty can apply along with the students, or at least one students who completed the graduation can apply. Besides BIG, there are several programs like SPURGE program, where the students after completing their graduation can apply for an immersion program of 18 months, where they will be getting a fellowship of 50,000 rupees per month for 18 months, and they can actually explore. Let's say that they are interested in the maternal child health. They will be taken to Fernandez Hospital and other places where they can see how this is happening, and they will be given a small grant of 5 lakh rupees. The students, they can form a small team and develop a simple solution based on their observations. In the BIG program, the students actually they expect them to take full time, so there is a possibility of 15 lakh salary component which they can take from the Biotechnology Ignition Grant if they are successful. So this is a maximum of 50 lakh rupees grant. We have actually, most of the time there are MSc students, researchers coming together and applying. They'll always need a senior to assist and to work with these incubators. Of course, since cell agility and others are there in SDM, they can actually work from SDM itself. Or if they are looking for any further help, we can help them.
Yeah, so Dr. Vishwas, who is also here in the audience, and who is a very fantastic example for SDM to be able to initiate such activities. Besides not only running his own innovation, he also runs a common facility for various other researchers to help in their experiments, which includes graduate, postgraduates, or any kind of researchers at SDM University. So under the big grant, you have a IHP collaboration, wherein you there is also, we saw that there is written that there is a health surveillance program. Can you elaborate on that? What kind of activities are envisaged in that program?
So actually, this is from this year onwards, India Health Fund. This is the Tata Group supported India Health Fund that is partnered with the Department of Biotechnology, BIRAC, for giving additional researchers with their funds for people who are working in public health, surveillance, tuberculosis, AMR related ones. So this is over and above the what are regularly given in the BIRAC grant. These will be additional grants that will be given. From COVID time onwards, the surveillance became a very important factor. There are few companies, they received multiple grants through various government agencies, be it wastewater or the municipal water monitoring solutions. So mainly the hospitals and the municipalities will be interested in understanding what kind of changes in the pathogen levels happening, so that indirectly it will help them alert their healthcare system to be prepared for those kind of things. What we have done is on 16th we have invited the India Health Fund team to join us, because India Health Fund actually they don't have any limitations, like in BIG there is only a 50 lakh limit, but India Health Fund actually funds in most of their programs more on the project basis, not like a 50 lakh. Here also I would suggest nobody should look at 50 lakhs, but they should look at what they want to achieve, and 50 lakh is just a starting point for them, just a de-risking mechanism. This grant I would look at like. On 16th, we are going to have much more elaborate session on India Health Fund and how they are planning to support, because this is the first time. Until all the 23 calls we have done for the life sciences. So I will be able to maybe connect the India Health Fund team with some of you people who are interested in surveillance related ones.
Yes, because the likelihood of product which is coming out of such kind of an effort is much less as compared to other areas. So that's why we were keen to know, primarily considering the fact that Hubli Dharwad area is, although it is a second tier city, has a large rural network, which is in fact linked to the activities, which is Hubli Dharwad acts as a central hub. So there are many health disparities which are currently being faced by the people who are living in these villages. So it is in this regard that I was keen to know, we are keen to know that what kind of a support which IHB along with the big would provide, which is not necessarily commercializable directly, maybe indirectly or in a different way, by being able to provide some kind of a services later on. So that was the interest. So this 16th meeting is open meeting, or it is exclusively with the...
No, this is again an open meeting, and maybe Surut will share the link with you. And I agree with you that when these technologies are developed for monitoring, it's not like a basic consumable or a general people will be using. This will be hospitals and maybe the municipalities, and the government will be the end user. And government is interested in certain places they are looking, but the BAZ and the IHF aim is not just about a regional thing, it's about solutions for India or solutions from India. So if they're thinking, they can provide to larger places, it's fine. But I agree with you in this, it will not be a directly sellable thing. The dashboard and monitoring, there will be a lot of assistance from various government agencies is required actually for setting up these monitoring things also, because they will be in the government related setups. There is a company actually in Bangalore, one of the Biotechnology Ignition Grant company that has set up, it's called Molecular Solutions. They have set up this monitoring solution, and of course they are further funded by BIRAC and IKP through various programs. In BAZ, they look at commercial viability. It's not that they have to directly sell that as a product, but how the company is going to survive after this 50 lakhs. What next the researchers will do is what they want to know.
So these are two independent grant proposals. There is one from Big by itself, and another is with IHP, or this call
This is
May
a
30th
single
is the last
proposal.
date. 30th
This
last
is
date.
a single proposal. Will be given two types of grants. So one is from the BIRAC, one is from the IHF.
Okay, thank you. So considering that most of the diagnostic applications or processes or development of kits are not necessarily patentable, so doesn't that decrease the chances of getting funded for any such efforts?
So in case of diagnostics, again in as Apurva has mentioned, various categories, how it will be evaluated. So there is a weightage for novelty, but if it is incrementally innovative, that is also acceptable. It need not be like only the disruptive solutions are funded, but if they can address unmet need, that is also perfectly fine. We have seen few solutions in the diagnostic space where they don't have IP, but they are addressing a particular solution by reducing the time and amount of money required. That is also acceptable.
So thank you. So in the AMR area, which you have indicated, there are two major things which we can envisage right now. One is that to be able to develop new antibiotics or to be able to develop novel diagnostics. What else would you see that will be considered under the AMR category of the big grant?
So again, always the drug development is an open thing in the biotechnology ignition grant. So there is a separate section actually for the drug development. Unfortunately, that is also limited by funding of only 50 lakh rupees. But for example, when Lamarck Biotech is developing, they have received a follow-on funding of another 4 crore rupees from National Biopharma Mission. So this BIG is seen as a starting grant for the companies who are bringing the solutions. It's not like the end grant, and they are not looking that at the end of these 50 lakh rupees they come up with a solution. So even if you can propose that we are developing the first 20%, and with the 20% we are going to the next level, that is also acceptable. So there is no restriction and the call is open. So it is up to the clinicians and hospitals or the researchers to propose what they would like to do. In BIG they don't want to restrict anything.
Thank you again. So one more question from our end is that how an entrepreneur would have a traditional medicine, which is in fact he or she wants to translate. How does that is considered by the PIC? Will it still pass through the process? There are few requests that traditional medicine they would like to translate, considering how it is approached as a black box experimentation and getting into the clinics and being able to treat people. So, is there an opportunities to be able to consider those kind of innovations?
So we have few actually examples where the practitioners have come up with solutions where they converted the subjectiveness into quantitative measurements. So I will take the example of one girl. Actually, she is a Ayurvedic. What is that company, Apurva? It's Nadi Pulse. So basically, the Vata, Kapha, Pitta. I'm not an expert, so please forgive me. When they go to an expert, they give very detailed analysis, and there is a it takes a lot of time in getting those things. So what the student or she was actually practicing has done is to develop a device which actually gives these parameters with clear numbers. She had a lot of tough time when she came first time, because what is the science behind and how you are going to prove. So what she has done is she actually measured the interviewers parameters and told that it's most likely that you slept after 11 o'clock in the night, and you might have ate something and still you are feeling uneasy in the stomach. And the reviewer is like, wow, this is super accurate. But what the entire committee is told is, we will give 50 lakh rupees, but what one reviewer said, wow, you have to make 200 people to say these things. So the traditional medicinal related things are little bit tough, but it's possible, provided that we can provide a scientific basis for those requests. The company name is Nadi Pulse. I would request some of you to look into those things.
Thank you very much. I am Dr. Prapanjan Gai here. So you mentioned about this 50 lakhs, right? And how is this classified? How do you segregate it? How much can be used for the research? How much can be used for the manpower and consumables, etc.? And whether the 50 lakhs is given at a time or it is, quarterly basis or something like this.
Thank you, doctor, for asking this thing. Actually, this will help others also to understand better. So first of all, for doing research, there will not be any budget. For doing the validation of any hypothesis, what you have seen, you want to test it, that will be funded. The budget classification is something like this: 30% for any of these following categories. So you can use a maximum 15 lakh rupees for salary, maximum 15 lakh rupees for outsourcing, maximum 15 lakhs for consumables, again maximum 15 lakhs for equipment if you want to buy. And of course there is a travel grant, travel money of 1 to 2 lakh rupees, for IP 1 to 2 lakh rupees, for renting a place in incubator up to 5 lakh rupees. And most of the BIG partners are very helpful, so you can come up with your budget and they will try to help you how you can present it. And regarding the second question, will it be given in part or in full? This will be given as tranches: 15 lakhs, 15 lakhs, 15 lakhs, and 5 lakhs over the 45 lakhs will be given over the time of around 13 months, and last 5 lakhs is given as a reimbursement. But now some of them have requested to give as in advance, so that is also possible. I hope I have answered. If it is not clear, please let me know.
Thank you, sir. I had one doubt, like what will be the ratio of every call firm, whether there is a restriction for the number of proposals or based upon the innovation?
So there is no specific restriction about number of projects to be funded. Every 6 months, I have seen the funding numbers are anywhere from 55 to 70. So there will be committees who will be evaluating the total in a year. Anywhere from 110 to 140 innovations are funded in the BIG program.
Hello, Dr. Vishu. This is Vishwas here. Thank you. Thank you so much for the support that you've been providing to Cell Agility and our what we are trying to do here in SDM. And also thank you, Apurva, for your help. I have a simple question. So once somebody graduates from BIG with a POC, what is the further process? How do they proceed?
So I mentioned the example of Dr. Vishal Rao and Lamarck Biotech. So in both the cases for Dr. Vishal Rao, when they have shown that they can actually provide a device that is costing 30,000 rupees to 60,000 rupees for 100 rupees, actually BIRAC gave them additional 5 crore rupees to set up a clean room to be complying with FDA requirements to manufacture that. So this is called National Biopharma Mission. Similarly, Lamarck Biotech, after they have shown in the animal studies about safety, efficacy, how the levels are, whatever their claims have been verified, they received an additional 4 crore rupees. And what I'm saying is there are government venues, but if we have a solution that where we can show, we should actually be trying to private people, because these things will take time. If a private party, if we can convince, that will be much faster. Of course, you will have to give a part of your equity. I feel that holding some percentage of value is more important than holding 100% of zero. So the next step is to share the equity and get into the development of the company.
Yeah, so IKP would help in that once we have the POC ready and all the validation ready.
So in some of these companies, we have invested. So that is more like an investment. It's not a grant.
All right.
Follow on.
Yeah. Thank you.
I have a follow-up question. So if there is a product which is probably successful, and what will be the, I don't know, shareholding of BIRAC in the product, or will there be any royalty? And for many,
okay. So yeah, before answering your question, I just want to say, the case of Vishwas, very few public or private institutes can provide, the cell culture facility, all those things the SDM has agreed to provide. So, if any researchers, doctors are coming with a solution, this 50 lakhs will be a starting, and I am sure you can go to, your institute and explore options to work there. So please, pursue this one and discuss, informally what all things can be done. Because I have known only 2 cases where such kind of help, when they have asked, is given. One is VIT Vellore, second one is the SDM Dharwad. Yeah. So coming back to your question, in this program, presently there is a clause which says that you need to pay the royalty, but royalty in the sense the amount of money you have taken. If you are successful, if you are selling, let's say you have a 10 crore sales from this product, then you have to return the 50 lakh money that you have taken. If you are not successful, you don't have to pay back anything. And coming back to the equity, IKP per se don't take any equity in any of these awardees. But if you are coming back to us, like in case of Dozy, Lamarck, that you want additional money, you want to raise next 5 to 10 crores, and there is a competition. It's a separate program. You need to apply for that. If you are eligible and if you clear all the rounds, then you will receive an investment. When you are receiving an additional investment after these 50 lakhs, then you have to share a part of your equity. But in this particular grant program, there is no equity component. And even the royalty component also, the government is planning to remove. We are still waiting for the orders. So, as you know, in government, we cannot say anything officially unless we receive the paper. I hope I have cleared.
Yeah, thank you.
Thank you. There are several people who have completed the other projects, like PACE project. and who end up in getting nowhere to be able to translate it to market uh, products or to be able to establish company. What's your advice on those such people?
So, I mean, I see there are two sides of this one. So, when a product is being developed, if we don't speak to the end user, and if they are not the stakeholders in the process of development, and if the product is not meeting the expected guidelines, so for example, the kind of biomaterial they use in this will not help the industry to buy that one, or the technology developed in particular project is not sufficient for industry to take it, then actually that product is just a research project with a translation angle being presented. So in some cases, the PI is unable to form a team that can take it forward. So what happened in most of the BSc programs, so for example, in IIT Hyderabad, University of Hyderabad, in all these places, even in Indian Institute of Science, Bangalore, what the faculty have done is after they received these 50 lakhs and when they have seen that there is a possibility to go forward, they had given the entire thing to the students. So the students are the owners of the company and the faculty are the institutes own a very small percentage of 10%. So the students have raised the follow-on money very successfully, anywhere from 2 to 10 crores. I would say that these all we need to look into the case by case study. So we can't generalize that after the PACE program they may not be going anywhere, but we need to form a team who will take actually full ownership and take the product development forward. We'll be happy to talk about those kind of things as a case to case study, because we can't generalize in these kind of things.
IKP helps in those circumstances to raise the funding also, right? Is that what you're suggesting?
So see, once a IKP awardee, they're always an IKP awardee. So we keep interacting and we invite to something called IKP annual flagship conference. It's called IKMC, International Knowledge Millennium Conference. This happens to be 25th year of IKP. So this is on October 26, 27, 28.
I'm referring to sorry to interrupt you. I'm referring to those PACE grantees, who came from the universities.
Yes. So what I'm saying is during those time, all these conversations happen. So when somebody decides they want to take it forward, they're looking for partnerships. So we invite the government agencies, we invite the funding agencies, we invite the hospitals. So that is the time they can actually find a partner who can work with them. So there are two kind of things that can happen. So they can give to a full person who will take it forward, or they can partner with them and take it forward. So we provide a platform. So per se, we don't do research, but we can facilitate such collaborations where they can work. I think Vishwas and team have come a few times to IKMC.
Good afternoon, sir. Yes.
Please go ahead.
As a research scholar, I just want to know, what about big supports for development of databases or bioinformatics tools for healthcare solutions?
So we have actually one student from Center for DNA Fingerprinting, CDFD Hyderabad. You might be familiar. I'm not getting her name. This is immediately after I joined. She actually came one day that I'm developing these kind of database related ones. So first time she was unable to convey how that will generate revenue, but she was able to convey the company name is Tanome. She was able to bring a business model, because it's very important. It's not about the 50 lakh rupees. How as a company they will survive and develop these things. So she was able to bring the genomic data into the database from CDFD, CCMB, and all other places, and how as a company they are able to do the service. So they were successful, but they would look at the commercial viability of these kind of things. Bringing a general database, and I want to provide free data to NCPI. No, BIRAC will not fund it. But if there is a business case, let's say that you will develop single nucleotide polymorphism in particular disease, and the hospitals will pay for accessing those things. Or let's say that mutations in a rare diseases, and rare disease consortium will sponsor it, or they will partner with you. So if you can bring in the business model clarity, yes, certainly this is possible.
Thank you very much, sir.
Thanks a lot, Dr. Visu. I think we're done with the questions. And thanks a lot, everyone, as well, for expressing the questions that you had. And as a follow-up of this,